Every day we form opinions about people, policies, healthcare decisions, social issues, and even ourselves. These opinions feel personal, deeply held, and rational. Yet social psychology reminds us of a humbling truth. Many of our attitudes are shaped, reinforced, and sometimes changed by forces we barely notice. At the center of this section is the concept of attitudes, our evaluations of people, objects, ideas, or events. Attitudes matter because they influence how we interpret information, how we interact with others, and how we ultimately behave. They act as mental filters, shaping what we notice, what we ignore, and what we believe to be obvious or common sense. Social psychologists understand attitudes as having three interrelated components. The cognitive component involves what we believe or think about something. The affective component reflects how we feel about it emotionally. The behavioral component concerns how we are inclined to act. While these components often align, they do not always do so perfectly, and that misalignment is where much psychological tension arises. One of the most important insights of social psychology is that attitudes are not fixed. They are formed through experience, socialization, and cultural messaging, and they can change, sometimes subtly, sometimes dramatically. This brings us to the study of persuasion. Persuasion refers to the processes through which attitudes are influenced by communication. We tend to imagine persuasion as something overt, advertising, political speeches, or debates, but much persuasion is quiet and indirect, embedded in everyday conversations, media exposure, professional authority, and social norms. A key framework for understanding persuasion is the elaboration likelihood model, which proposes two primary routes through which attitudes are shaped. The central route involves careful, thoughtful consideration of information. When people are motivated and able to think deeply, they evaluate arguments based on logic, evidence, and coherence. Attitudes formed this way tend to be more stable and resistant to change. In contrast, the peripheral route relies on cues that are not directly related to the quality of the argument, such as the attractiveness of the speaker, emotional appeals, repetition, or perceived authority. Attitudes formed through this route may change more easily, but they are also more vulnerable to manipulation. Which route people take depends on context. Fatigue, stress, time pressure, and emotional intensity all make peripheral persuasion more likely. This insight has enormous implications for healthcare, ethics, and public decision-making, where individuals may be highly influenced precisely when they are least able to engage critically. Social psychologists have also identified several factors that increase persuasive effectiveness. The source of the message matters. People are more persuaded by communicators they perceive as credible, confident, and trustworthy. The message itself matters, whether it appeals to logic, emotion, fear, or values. And the audience matters. People are more persuaded when messages align with their existing beliefs, identities, and social groups. But persuasion is not only about influence from the outside. One of the most fascinating findings in social psychology is that people are often persuaded by their own behavior. This phenomenon is captured by the theory of cognitive dissonance. Cognitive dissonance occurs when individuals experience psychological discomfort because their attitudes and behaviors do not align. Humans are deeply motivated to reduce this discomfort. Sometimes that means changing behavior, but often it means changing attitudes to justify what has already been done. For example, if someone acts in a way that contradicts their stated values, they may later reinterpret those values rather than admit inconsistency. This process helps explain how people come to endorse beliefs they initially resisted and why moral compromises can gradually escalate over time. Importantly, cognitive dissonance reveals that attitude change is not always the result of persuasion from others. Sometimes we persuade ourselves. Taken together, the study of attitudes and persuasion challenges the comforting belief that our opinions are purely the product of independent reasoning. Social psychology shows instead that attitudes are dynamic, socially embedded, and deeply responsive to context. Understanding these processes does not make us immune to influence, but it does make us more aware. And awareness is the first step toward ethical reflection, critical thinking, and intentional decision-making in a social world that is constantly trying to shape what we believe.